Autism is a lifelong disorder that affects a person's social, communication, and behavior skills, and can have a major impact on a person's functioning in everyday life. Unfortunately, it is often difficult to spot autism in men early on due to the fact that many signs and symptoms can be misinterpreted as simply being part of the male personality, making early diagnosis and treatment difficult. Diagnosing male autism starts with identifying any behaviors that may suggest the presence of ASD. Signs of male autism include difficulty making conversation or maintaining eye contact, difficulty understanding other people's emotions and nonverbal cues, repetitive speech or unusual preoccupations, lack of interest in social activities or peer relationships, rigid adherence to routines and resistance to change, problematic sensory processing such as avoiding certain sounds or textures, and hyperacusis, sensitive hearing. To help properly diagnose male autism, there are specific diagnostic guidelines recommended by healthcare professionals, which include gathering information about family history and current functioning level, as well as conducting various physical examinations like EEG tests, electroencephalograms, cerebral spinal fluid analysis, CSF, analysis, blood tests including thyroid function tests, metabolic screening tests, etc. Psychological assessments such as self-report questionnaires designed specifically for assessing autistic traits, etc. Functional assessment measures such as task completion assessments used to evaluate self-help skills, etc. Intelligence testing procedures like IQ testing, etc. Neurological exams evaluating motor development functions, which should all be taken into consideration when diagnosing ASD among males patients. Males are typically diagnosed later than females, and many symptoms may be mistaken for other conditions or simply go unnoticed. Some of the most common signs and symptoms associated with male autism include difficulties with social interaction, repetitive behaviors, communication problems, limited interests or activities, and extreme anxiety or fearfulness. These behaviors may vary from person to person, but they tend to cause significant impairment in day-to-day functioning, since individuals on the spectrum often struggle with understanding instructions or knowing how to appropriately interact with peers their own age group. Educating yourself about these disorders as well as observing any potential behavior changes should take priority when dealing with this life-changing issue. If you notice one or more typical characteristics described above in your son's behavior, then it's important that he receives an appropriate evaluation from a qualified expert such as a developmental pediatrician specialized in diagnosing autism spectrum disorder, ASD. Diagnostic guidelines for adult male autism. Diagnosing autism in males, autism spectrum disorder, ASD, is a complex neurological disorder that affects more males. Because of the wide range of potential symptoms and behaviors associated with autism, it can be difficult to accurately diagnose ASD, especially in adult males. Knowing what signs to look for can help clinicians make more informed diagnoses when treating them. Understanding the diagnostic guidelines for male autism is essential to helping both adults and children receive prompt treatment so they can live happier and healthier lives. Signs and symptoms of male autism. While there are many common signs and symptoms associated with autism across genders, some key indicators may present differently or even exclusively in men on the spectrum. These include difficulty communicating verbally, impaired social skills such as lack of eye contact or understanding personal space boundaries, repetitive behavior patterns such as stimming or rocking back and forth motions, difficulties regulating emotions including outbursts or meltdowns, resistance to change or transitions into new activities, environments, intense interests focused around specific topics, items, e.g., trains, avoidance of physical affection from family members, caregivers, etc. Diagnostic guidelines for male autism. Once certain behaviors have been observed resulting from narrowed-down criteria used for evaluating children displaying genuine indications resembling those listed above according whose ICD checklist as well best practices outlined by American Psychiatric Association guideline, then diagnosticians must consider comprehensive psychological assessment completed piecemeal using various tools specifically aimed at diagnosing case to ascertain extent of severity of the condition. Clinicians may also use additional assessments like psychoeducational testing and clinical interviews to qualify their findings and to confirming whether patient falls within acceptable parameters conforming with DSM-V categorization criteria. It is essential for clinicians and those affected by autism to recognize the signs and symptoms of male ASD so that they can better understand its unique challenges. By understanding these distinctive characteristics, early diagnosis and effective treatment plans can be achieved with greater success. Autism in males has some unique signs and symptoms as listed above compared to females, which must be taken into consideration when diagnosing male patients with suspected ASD. They may also include difficulty making eye contact, an unwillingness to communicate verbally or nonverbally, social aggression or withdrawing easily from social situations, as well as persistent obsessional interests or behaviors that may not conform to what is socially acceptable, such as repetitive motions like hand flapping or rocking back and forth. Additionally, language difficulties including delayed speech development are often a symptom of male autism, though this should not discount the possibility of verbal fluency showing skills earlier than expected according to situation or interest level within certain topics. Recognizing the signs of autism in males is essential for proper diagnosis, but it can also prove challenging due differentiating between traits associated with normal teenage behavior versus those associated with autistic behavior issues. For instance, a clinician should take note if there are any delays in motor development, especially if milestones such as rolling over on time have been missed along with an inability gross motor tasks. Examples such holding his head up unassisted longer than 3 seconds could signify future medical health implications regarding cognitive function without further investigations being made into details outside the given zone perimeters provided at follow-up visits. Diagnostic guidelines for male autism often require comprehensive assessments using both parent interviews and observational techniques alongside behavioral observations, since any indicators present need accurate evaluation to determine their impact on patient progress. When prescribed therapeutic remedies concerning psychological well-being treatments regimes, long-term management programs, schooling structures coexist side by side specialist care practices depending upon nationwide state-related protocols administered through central government. Organization documentation are issued yearly based on updated surveillance data collected via primary healthcare departments serving local communities, centers regionally placed throughout designated urban-rural districts across involved countries abroad. In addition, diagnostic assessment tools provide proper clinical judgment while working closely with relations of individuals and families experiencing heightened levels of stress and anxiety caused by severe disruptive behavior problems resulting to conflict situations within home setting. Autism spectrum disorder, ASD, is a complex, lifelong condition that affects the way individuals communicate, interact with others and perceive the world around them. ASD can present differently in males than it does in females, making identification and diagnosis of autism especially difficult when dealing with males. That's why it is important to understand the unique signs and symptoms of male autism as well as appropriate diagnostic guidelines for proper assessment. In addition to these general traits seen across both genders, there are certain signs that are more commonly associated with males who have autism, such as engaging in risk-taking activities which can cause harm to themselves or others, being increasingly aggressive, displaying chronic aggression towards other people, having extreme sensitivities related to sound or texture, experiencing great fear towards changes in routines, exhibiting hyperactive behavior involving running away from home and/or lack of awareness regarding danger. Overall, identifying the early warning signs of autism in men is not an easy task. However, by understanding the signs and symptoms and using diagnostic guidelines for male autism, it is possible to recognize the signs that can lead to a formal diagnosis. If you suspect that a man may be on the spectrum, consult your doctor or specialist for more information and advice. Thanks for watching.